Well, hey guys, in today's video, I'm gonna answer some more of your questions. As always, there will be timestamps or chapters down below in the description box. So if you wanna hop to, quite literally hop to a question that you're interested in, by all means. It's actually the night before, but I wanted to pop on here and share with you guys some items that I just got from Lily Silk. Today's video is sponsored by Lily Silk. You guys know I'm a huge fan of Lily Silk. I sleep on their pillowcases every night. They have a ton of high quality, 100% mulberry silk clothing, apparel, accessories, sleepwear, and I just got this beautiful new robe. Check out the pretty little tie here, very nice quality. I've always been really impressed with the quality and craftsmanship of Lily Silk items. The stitching is very good, super durable. I mean, it's 100% mulberry silk. Why silk, you might ask? Well, silk is a super durable material. I mean, it lasts forever. So it's definitely an investment, but it lasts a lifetime. And Lily Silk, I've always been actually very impressed with their pricing because for the quality, they really have reasonable prices. From a skin and hair perspective, silk is advantageous because it's very breathable. So that's good if you deal with eczema. You know, getting overheated can really flare eczema and cause some irritation on the skin. Plus it's just like very smooth on the skin. And I love sleeping on a silk pillowcase because not only does it keep me cool, but it's just nice and smooth on the skin. It doesn't lead to any irritation as I turn my head from side to side. I typically have my purple pillowcase on, but I'm gonna swap out to this new yellow one that I just got. I love their pillowcases. I sleep on one every night. I'm just putting it on here, but I wanted to share with you guys, I got this pillowcase in a set that I think would make a fantastic gift. Speaking of gift, one thing I love about Lily Silk, their items always come in these really nice boxes. You literally can just put maybe a bow and a gift tag on this and you're done. You don't have to worry about gift wrap because the box is so nice. Anyways, I wanted to share with you guys, not only does the set come with the pillowcase, but it comes with a mask. Silk is a perfect fabric for masks because it's smooth on the skin and it doesn't rub and cause irritation that leads to mask breakouts. So you get a mask and you also get, these are an essential for me, you get an eye mask. Silk is nice if you deal with a lot of breakage, and for your eyes, having an eye mask, it's, you know, a nicer fabric for your eyelashes. You don't want a rough fabric in your eye mask because that can cause irritation, not only for your eyelids, but lead to lash breakage. So I love these Lily Silk eye masks. They are the best. And you can adjust the headband to your comfort, to the size of your head. This is the best gift. Have you ever had an eye mask and you kind of actually overheat? That's the nice thing about silk. It's really breathable, so you don't overheat when you're wearing it. Likewise, this is probably my favorite thing that I got from Lily Silk. I have a long pink silk nightgown that I wear a fair amount from Lily Silk and it matches this. That's the other thing I like about Lily Silk is you can get stuff that matches. And so for example, you can get a robe and then you can get a nightgown to match, and you can get like the sleep set with the mask to match. Definitely check out Lily Silk, and I'll put links in the description box to everything that I've shared with you guys, but thank you Lily Silk for sponsoring today's video. Number one, I have blackheads. I've been using salicylic acid and they won't go away. It's basically the pore gets clogged and the contents of the pore are exposed to air and that oxidizes and turns a black color. Some people just have larger pores. They have larger oil glands. They're more likely to have blackheads. Some people become more blackhead prone as a result of a lot of sun exposure because the sun damages the surrounding supportive framework around the pore, making it dilate and more prone to blackhead formation. Or some people who smoke likewise have destruction of that surrounding supportive framework. And they develop very prominent, what are referred to as smoker's comedones, basically blackheads due to smoking, plus a combination of smoking and UV exposure can really do that. But you know, maybe you don't smoke and you try and protect yourself from the sun and you still have blackheads. There are some other ingredients that certainly can help. Retinoids, tretinoin especially, It normalizes keratinocyte cell turnover within the pore, preventing clogging. And it also helps to inhibit something called transglutaminase, which is what is responsible for making the cells in the pore so sticky and kind of clumped together. Tretinoin will prevent plugging up of the pore, and it's the plugging up of the pore with the cells that ultimately causes a comedone. And as the contents get exposed to air, it oxidizes and turns black. Glycolic acid also may help to a certain extent, especially in the very top part of the pore. Certain clays like kaolin, bentonite in a mask can help absorb excess oiliness and it kind of extrude it from the top part of the pore, and that also may help. Your diet may be playing a role as well. Some diets increase sebum production, and that's definitely going to contribute to blackhead formation. Diets that are rich in sugary processed foods, they increase insulin-like growth factor that drives oil production in the skin. It can be actually pretty tough to completely eliminate blackheads. What is the difference between tretinoin and adapalene? All right, both are topical retinoids that are used to treat acne. Tretinoin was discovered first. It is a first-generation topical retinoid. And it was first used as an acne treatment, and still is used as an acne treatment. And most people are motivated to use tretinoin because we later learned that it has the benefits of improving wrinkles and fine lines and removing sun damage. So it's been used for a long, long time. Unfortunately, tretinoin has a few disadvantages in that it's very irritating, especially in the beginning, although many people get used to it. And it's not really that stable. So as you know, a lot of ingredients can compromise the stability of tretinoin, like benzoyl peroxide. And it's also not stable in the presence of light. That's why we've always told people to put it on at nighttime. So later on down the road, more retinoids came out besides just tretinoin. And they had modifications on them that made them unique. And one such is Adapalene or Differin. Now, Adapalene is much newer, has a unique physiochemical profile in that it has a greater affinity for the pore. So making it, hone into the site of acne better. It's photostable, so you don't have to worry about it degrading in the presence of sunlight. So technically you could put Adapalene on in the morning if you wanted to, and it would work just fine. And it's stable in the presence of other ingredients. That's why you can use it with benzoyl peroxide, unlike tretinoin. And in fact, the combination of benzoyl peroxide and adapalene is what is Epiduo, a prescription drug that is a prescription topical that is both ingredients, because they are stable together. Now, the other advantage of adapalene is that it is much less irritating. Now, because adapalene is a newer drug and it met FDA approval for acne, it's pretty much only been used as an acne medication. No one's really bothered to spend much time figuring out, well, does it boost up collagen production? Does it improve wrinkles and fine lines? So we really don't have that kind of data with adapalene. There are some studies that do show that applying topical adapalene to the skin improves the look of sun damage and can improve sunspots, but we don't have the wrinkle smoothing data for adapalene like we do with tretinoin. Number 3, what are your thoughts on Accutane for sebaceous hyperplasia? These little yellowish bumps that can happen pretty much anywhere, and they are basically enlarged sebaceous glands. There are a variety of procedures that we can do to remove them. They're not dangerous, but cosmetically they bother people and they want to remove. So there are a variety of, easy, straightforward procedures we can do to remove them. They don't typically cause scarring or anything, but there is a cost associated with that because it is considered cosmetic, so you have to pay out of pocket for it. And removing them does not guarantee that you won't get more. What about isotretinoin, which is an oral retinoid that you take by mouth? Brand name is Accutane. That actually has been shown to help clear up sebaceous hyperplasia. Unfortunately, you can't necessarily be on Accutane forever. And when the Accutane is stopped or the isotretinoin is stopped, the sebaceous hyperplasia often comes back. Now, I did say that you can't necessarily be on Accutane forever, but believe it or not, there are some people who take low-dose Accutane for a long, long time for kind of an anti-aging benefit. Because isotretinoin, it has other benefits. And so many people do take low-dose Accutane for a long time. Now, topical retinoids like tretinoin can also help in keeping them at bay and minimizing their appearance, helping to prevent more from coming. So that might be something to discuss with your derm if you are motivated to go on a course of Accutane, and then afterwards transitioning to Tretinoin. Why can we not use topical retinoids like Tretinoin while we're on Accutane? All right, Accutane, if you're not familiar, as I said, it's an oral retinoid. And the first few months that people are on it, they develop a lot of dryness, peeling. That is expected. It's not even referred to as a side effect because side effect implies some kind of, off-target effect. Side effect is not the right word here. It's actually an expected effect. In fact, if you don't develop the dryness and peeling, it means you're not taking it, period. And so why do we say no topical retinoids? Well, first of all, it's redundant. You're consuming an oral retinoid that gets into the skin. Applying it topically where you have the barrier of the skin for it to enter while it is effective, it's like, why bother? It's not adding anything additional. But topical retinoids like Tretinoin, they're irritating. Topical retinoids, topical salicylic acid, any kind of exfoliant, we would stop while you're on Accutane, just because the skin's very sensitive. And instead you want to use moisturizing ingredients. I have a video which I'll link down below on my Accutane skincare recommendations, so check that out. Can we use vitamin C serum with hyaluronic acid serum? And if so, how, what order, and can we put moisturizer on over? A lot of questions within this question. But short answer, yes, you absolutely can use vitamin C serum and hyaluronic acid serum. But pay attention, there's a good chance your vitamin C serum may already have hyaluronic acid in it. It's in the SkinCeutical CE ferulic. So look at the ingredients, because adding more hyaluronic acid, it really just could potentially increase the risk of irritation. Hyaluronic acid does increase penetration of ingredients and can make them more irritating. So be careful if you have a product with vitamin C and hyaluronic acid and you want to add another one. Not to say that you can't, but you may get diminishing returns and you may get a greater risk of irritation. But hyaluronic acid is safe to use with vitamin C. It's not going to compromise the stability of ascorbic acid like other ingredients can. In fact, like I said, you will find that ascorbic acid serums often have sodium hyaluronate in them. So yeah, you can combine the serums together. But again, just be mindful of what you are already using. I always tell people to apply vitamin C serum in the morning because you go out, you're exposed to UV and pollution, generates free radicals. So having the vitamin C in the morning, it kind of makes sense. Maybe it would reduce some of that oxidative stress. Although vitamin C, ascorbic acid, a properly formulated one that actually can get into the skin, it does have a depot effect. So it kind of builds up in your skin. And so if you're using it at night, you can still have the benefit of it throughout the day, in other words. But I always tell people to put it on in the morning. And if you're going to use a hyaluronic acid serum, it doesn't really matter the order. Although honestly, I would say put your vitamin C serum on first. Why? Well, vitamin C, or at least ascorbic acid, it's very difficult for it to get into your skin. So just to kind of cut your losses, I would say put that on first. And then apply the hyaluronic acid serum. And I would apply these to damp skin after cleansing, actually, to enhance penetration of the vitamin C. And the hyaluronic acid is a humectant, so you want it on damp skin to bind the water and just kind of help it hydrate up the top layer of the skin to smooth out wrinkles and fine lines. And then I would apply moisturizer on over it, or in the daytime, definitely apply sunscreen on over it, because that is really, essential for your vitamin C to do anything for you. Sunscreens, remember, they're going to protect you from UV rays, and vitamin C is there. It may work, it may not, and it's there, and if it works, then it's going to help cut down on oxidative stress from those UV rays. All right, you guys, that is another Q&A. I hope you all enjoyed this. I hope I answered some of your questions and that it was informative, even if you didn't ask these questions. Thank you for watching. If you enjoyed this, give it a thumbs up, share with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.